Thanks for joining us today, everybody. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us on the line, we have Marlo Pritchard, President of the Saskatchewan Public Safety Agency. We have Scott Livingstone, CEO of the Saskatchewan Health Authority, and we have Dr. Susan Shaw, Chief Medical Officer with the Saskatchewan Health Authority. Both Premier Moe and Dr. Shahab will have opening statements, and then we'll have time for questions. Premier? Great.
Good afternoon, everyone, and thank you for joining us today. Today we are reporting 4 new cases as well as 11 new recoveries. All of the cases are in the far north, and the situation there appears to be improving. The virus continues to spread, however, throughout the far north, but it is spreading at a much slower pace than it was a week ago or 10 days ago. And that is thanks to the tremendous effort by so many people in that area, all working together, all working collectively to address the outbreak. What you're doing, it's working. So once again, I say thank you. Over the past 3 days, we have had no new cases outside of the far north, and the number of active cases continues to steadily decline. This is good news, but I still need to once again remind everyone to continue to be careful, as we are now at a very crucial moment. With the weather getting warmer and the long weekend coming up, we are seeing a great many more people that are out and about, and there's nothing wrong with that. In fact, it's great to see. So long as everyone keeps up all of the good physical distancing measures that have been working so very well thus far. This weekend, you might be enjoying your first round of golf of the season, or you might be heading to the lake to do some day fishing. Or you might just be having a backyard barbecue with family and friends from one or possibly 2 other households. Then on Tuesday, we are going to see a number of additional businesses that will reopen in communities across the province. And it is great to see this taking place. But it will only be successful if we keep up all of the good practices that we've learned and become accustomed to over the course of the past couple of months. We know that this virus can be controlled if we continue to do the right things. But we also know that it can spread quickly if we don't do those things. So let's be careful so that we can keep reopening our economy and enjoying our beautiful province at the same time. Today we are highlighting a number of new highway projects under the Building a Strong Saskatchewan plan that we released the other day. An additional $300 million is being invested in highways and in transportation projects as we work to quickly restart the Saskatchewan economy. These projects will include upgrades to 325 kilometers of thin membrane surface highways, or TMS highways, 24 to 26 new sets of highway passing lanes across the province, and rehabilitation of at least 100 RM roads when combined with our existing municipal roads program, as well as some improvements to our community airports. This is in addition to the $358 million worth of highway projects and highways investments that were previously announced in the March spending estimates, including 9 sets of passing lanes, as well as resurfacing projects between Regina and the Canada-US border. 4 sets of passing lanes, as well as resurfacing between Delisle and Kindersley, and 2 sets of passing lanes and resurfacing projects, as well as widening between Saskatoon and the junction of Highway 2. 3 sets of passing lanes on Highway 10 between Melville and Yorkton, as well as 3 sets of passing lanes on Highway 9 between Yorkton and Kenora. This year's plan includes improvements to more than 1,000 kilometers of provincial highways, which is the first year of the 10-year growth plan to build and upgrade over 10,000 kilometers of highways. And finally, I just want to mention that our government has responded to the Chief Electoral Officer's recommendations to ensure that a safe and successful fall provincial election can occur. Today, Cabinet approved the changes to the Election Act regulations to give the Chief Electoral Officer clear authority to take any necessary action that he seems necessary to ensure that the October 26th provincial election is conducted safely in light of the COVID-19 pandemic. These regulation changes clearly define a public health emergency as an emergency under the Elections Act, and it gives the Chief Electoral Officer the power to adapt any provisions to the Act to address health and safety concerns Everyone needs to feel safe about having the opportunity to go vote this fall. That means ensuring good physical distancing practices for both voters as well as Election Saskatchewan workers, just like we do now in grocery stores and many other public places. I have every confidence that the Election Saskatchewan will take the right steps to ensure that a safe election can be conducted for all of those involved. With that, I will turn it over to Dr. Shahab for a few comments.
Thank you, Premier. So just summarizing some of the numbers, I think we need to recognize that there are two slightly different stories occurring in Saskatchewan, and both are very positive. First of all, we all know that there was an intense outbreak in the Northwest, which is now on the way down, and this is due to the significant efforts by Northern leadership, by health staff, public health in the North, with great support by the Saskatchewan Health Authority, by the Saskatchewan Public Safety Agency, policing, other partners, social services, all coming together and supporting communities in the Northwest to really manage the outbreak in a way that it's certainly showing results. And I think this is really positive, that even if there is an outbreak in the North, this shows that with determination and coordinated effort, it can be overcome. So I think we just need to recognize the efforts that are put in place for that. But of course, they need to sustain the effort, and we need to continue supporting that effort so that it finally, settles down to and comes to the same level as the rest of Saskatchewan. And that, of course, is the other story, that with very few active cases and no active cases in most of Saskatchewan, it really does set up us well for reopening of phase 2 next week. But again, to reinforce what the Premier said, we need to continue as we go out and about and enjoy the outdoors and enjoy the warm weather, enjoy the long weekend. We need to continue to have that diligence to maintain physical distancing between members who are not part of our household or our virtual household. And as long as we can do that, we can continue to reopen other sectors of the economy and stay the course. But of course, if there is a cluster or an outbreak, that will then have to be managed within the context of the setting in which that has happened. And again, we get lots of messages that gatherings of 10 are allowed. Can I go out with my 10 friends or have them over? I think it is important to recognize that we do want to. There's going to be an increase in our social interactions, even though we are going to be maintaining physical distancing as we go out and about once phase 2 reopens. It is going to increase a bit our social mixing. So as much as we can limit social mixing in our social lives, I think that is good. So, the recommendation still is that while gatherings of up to 10 are allowed, it is a strong recommendation that stick to 2 or 3 friends or 2 or 3 households and meet among yourselves as a virtual household, and not have meet with 10 new people every day, because that just increases the risk overall, even when things are very quiet. And we just need to stay the course as phase 2 opens and look at future opportunities while maintaining some discipline in our social lives and as we're out and about enjoying the outdoors. So I'll just stop there. Thanks.
Thank you, Doctor. Thank you, Premier. We now have about half an hour for questions. We'll take our first question from the room here, Arthur.
So this is for the SHA. I've been getting reports that the number of mobile testing teams in the Loche area has fallen far short of the 19 that were promised at first. I've heard 2, I've heard 4, it varies. I was wondering if you could confirm how many there are and explain if it has fallen short of that 19, why, and whether that's had any impact on your testing capacity.
For the SHA on the line, could you hear the question?
Yep.
Great.
Thanks for that, Arthur. So again, after we did initial planning and identified what we were needing to do to increase mobile testing in Loche, which was the announcement of those multiple teams, the MHO in that community, through their order, began to stay at home and felt that we needed to change the strategy. So to ensure that we were containing the spread of infection, as you know, we launched second phase of active case finding, which included door-to-door strategic testing approach. And we have deployed over 35 staff to the Loche to do that, which includes door-to-door assessment, mobile testing, the drive-through swabbing, case identification, and contact tracing. The mobile teams There are not 19 mobile teams, because although they would have enough people to break them up into the teams, they've made it a smaller group of folks going door to door, coordinating with the community leaders, and ensuring that we are keeping up with both not just our swabbing and testing capacity, which has never been at risk. We are still and continue to swab and are committed to going to every single household in that community. I believe we've already gone to 200. And that will continue. And as you can see by the results in the north, we are making progress with respect to not just identifying the cases, but also containing the spread. The results over the last few days are confirming that. And we will continue to do advanced testing throughout the community, not just on close contacts and folks with symptoms, but asymptomatic folks and anyone who's looking to get tested up in the far north. So no, it did not affect their testing strategy.
Follow up, Arthur?
Yeah, so first off, how can we, 200 is only a fraction of the population of that community. How can we know that these lower case numbers aren't related to our testing strategy, first of all? And I also wanted to go in a slightly different direction here, because I've been hearing concerns from rural residents, particularly in the community of Arcola, who have a lot of concerns about the plan to close the emergency room of their hospital. And I guess I'm just curious why we're moving forward with that when there's essentially no cases in the southern region of the province.
Okay. So there's a couple of questions in there. So let me deal with the first one, Arthur, around the 200 people. I didn't say 200 people, I said 200 households. And as we talked about before, there's 750 households in the Loche area, and we will be going door to door to all of them over the next week. So it's 200 households, not 200 individuals. There's been well more than that tested. I don't know the exact number, but we could get that on follow-up. With respect to the alternative level care conversions in the 12 facilities in rural Saskatchewan, which were part of the defensive strategy associated with both the COVID response, also related to our building capacity to restart the healthcare system, and at the same time protect those residents in long-term care that are in integrated facilities. Why we're moving forward with the plan is multifold. The one is to protect those folks in long-term care and to use the facility's capacity to provide care for alternative level of care positions in our larger facilities, so that we can both build capacity to support the reopening of the healthcare system, but also maintain capacity for COVID surge and outbreaks as they arise throughout the pandemic. So this was announced weeks ago. There have been discussions with local communities and mayors around this, and when we said we were going to implement it in 4 to 6 weeks, we started doing that last week and this week, and that's where we are today. And we will continue to manage our capacity, as the Premier has referred to it before. Once we restart our healthcare system next week, we will be using that dimmer switch as we watch what happens across the province with respect to, the mixing of individuals with reduced restrictions, and in the opening of other components of the economy, we'll have to jump on those outbreaks, and that may change the types of services we are able to offer to the community based on how we're managing COVID surges throughout this period of time.
I'll just add to that, Arthur, and this is a note of appreciation to the federal government for their support in our efforts in the Loche and in Clearwater and in that region. The federal government had supplied or provided us with 25,000 or some personal protective equipment in the way of 25,000 sets of gloves, as well as some masks. More recently, the federal government has also provided us with 1,000 cartridges for our Gen Expert kit to use not only in the Loche area, but throughout the north. And so in addition to us having the testing capacity through the Roy Romano lab to test all of the households in Loche if people should choose to test, we also have that rapid turnaround capacity in the community as well for those that may be deemed to be at higher risk, and you want to get a quicker turnaround of the results of your test so that you can move right into your contact tracing. So the federal government has been very supportive of the initiatives that we have been conducting in Loche, and for that we're appreciative.
We'll take our next question from the phone line, operator.
We have Alicia Bridges with CBC.
Thank you. My first question is regarding the north. Is the Saskatchewan government actively considering relaxing the northern travel restrictions for residents in the northeast region of the administrative district, or any parts of the district, and if so, which specific areas?
So there is conversations ongoing with respect to all of our public health orders, but in particular and Dr. Shahab may have a little more to add to this. But understanding that we moved with a public health order across the north as we saw an outbreak that was starting and in motion really in the northwestern portion of the province, and it was spreading into communities near there, and there was nervousness that it was spreading into other communities, not only throughout the north, but also into southern communities in the province as well. So we had Dr. Shahab had put forward a public health order limiting the travel not only north and south into the Northern Administration District, but also between the communities in the Northern Administration District. And really what that was to do was to settle down the spread of this virus and to really get a control over the spread of the virus so that it doesn't get into all of our northern communities and into many other communities in the province. And I think with the numbers that we have seen since that public health order has been put in place is they are improving, and we are starting to get to a much more manageable situation, and we are able now to say that there are, for all intents and purposes, not, I believe, any active cases in the northeast or the central areas of the northern part of this province, and they are concentrated into that northwestern region, and we're working very hard to ensure that we're able to get that particular outbreak under control, and with the help of local leadership and individuals, I think is really a thank you to individuals for progressing and taking their personal responsibility around physical distancing very seriously. We are getting this into a manageable situation. So in the days ahead, not before the May long weekend, this coming weekend, but in the days ahead, I think it is fair to say that if these numbers hold, we will have a discussion with northern leaders as well as with others on can we really focus our restrictions to where they need to be and ensure that the restrictions are doing what they set out to do, which is to curb the spread of the COVID-19 virus and not impact those communities that aren't currently being impacted with infections. But like I said, that's days away, not previous to this weekend. Anything to add to that, Doctor?
Follow up, Alicia?
Yes, thank you. Just this next question is related to reopening next week. Can you explain why malls will be allowed to open on Tuesday, but libraries that provide public services can't be open?
So what would be open? Sorry?
Malls.
Malls,
Oh.
sorry.
Do you want to speak to that, Doctor?
So I think obviously there's, with zero active cases in most of Saskatchewan, there's a lot of interest in many sectors reopening, and we can understand that. But we had to start in a phased, stepwise way, in a way that we can closely monitor as various sectors open. First of all, to make sure that as businesses open, they're able to apply the learnings from the essential services that were open throughout. And then as they open, both customers and business owners are able to operate in a way that we do not see any increase in transmission. So from that perspective, obviously, in phase 2, there are non-essential retail and some personal services that will open. And it is critical that we are able to see that after, for at least a 2 to 4 week period, once phase 2 reopens, we do not see any increase in transmission. And once that, there'll be consideration of phases in the future. And we also understand that when you go into a retail environment, there's clear guidelines about, minimizing browsing, touching multiple articles, picking what you need. The way businesses are being designed is that there's always that physical distancing, either as you're going about the aisles or as you're going at the checkout. In libraries and those kind of settings, it's a different environment. There's terminals with computers. There's lots of areas for children. Those are environments that are very enriching. So special consideration needs to be given to those environments which are a bit different from a retail environment.
I would just add, Alicia, with respect to malls, again, I go back to the dimmer switch analogy, if you will, where there are still going to be quite serious restrictions around food courts, for example, and some of the communal areas where people might eat. So it isn't 100% back to normal in the retail environment in malls. It most certainly is providing those retail establishments the opportunity to open, but there still are a number of restrictions on how they'll operate within their retail facility, as well as how the broader mall is actually going to have access to certain areas of the mall, such as the food court.
Take our next question from the room. Steph?
Yeah, Mr. Premier, there were concerns raised by a First Nation in Saskatchewan of RCMP officers attempting to stop a traditional Indigenous ceremony from happening on First Nations territory. We know that there is a 10-person limit on gatherings in Saskatchewan. Why is there no exemption given to First Nations ceremonies, traditional Indigenous ceremonies on their land to allow for more than 10 people?
Because the virus doesn't care. It just simply doesn't. There are other religious and cultural gatherings that have gone to great lengths to modify their worship services, to modify their gatherings so that they may continue to occur, but in a much different fashion than what they may have previously. We're nearing the end of the season of Ramadan, for example, where we have seen a very different celebration of Ramadan than we have likely ever seen in for sure my history and I think probably every living person's history. So the fact of the matter is this virus is very indiscriminate in how it spreads and who it impacts and affects. And the public health orders that are in place, they need to be followed for the safety and health of everyone.
Follow-up, Steph?
Yeah, it's a bit of a different question, an entirely different question. It's presenting spending estimates and then 3 different scenarios for revenue projections is not the same thing as a full budget.
Right.
Will you present a full budget before people go to the polls in the legislature?
Our intent and our preference would be to present a budget in the legislature so that it can have the legislative oversight that it should have and that, quite frankly, all budgets deserve, and in particular this budget deserves. That being said, and understanding that we are operating in a new normal environment, if you will, that won't occur under the conditions that we had previous to going into COVID-19. That's why our House leaders have been meeting for some time now, trying to come to some type of a modified sitting arrangement, if you will, so that we could introduce a budget in the House and have the legislative oversight that every budget deserves. I would say this budget in particular deserves not only the legislative oversight, but the purview of every person in the province because of who it invests in. It invests not only in rebuilding our economy through infrastructure in the budget and additional infrastructure commitments since then, but it also invests in communities and families and invests in individuals across this province. So our preference is to introduce and have a modified format to pass a budget and have that legislative oversight. If we are unable to come to an agreement if the House leaders are unable to come to an agreement, there is other opportunities and already has been opportunities for the people of this province to purview not only the spending estimates but ultimately the budget before we go to an election this fall. As you mentioned, we introduced to the public the spending estimates this spring. In June, we will have the release of our public accounts. The Minister of Finance has already released a number of different revenue projections as the Ministry of Finance can best assess those at this point in time. In August, and she's going to do another revenue projection in June as well as to update what we had already released. And in August, we're going to have our first quarter budget update, which will release all of the investments to date, as well as the revenue that the province has received to date, as well as the projections for the rest of the year. So our preference is to go into the House with that legislative oversight. If we are not able to if the House leaders are not able to come to an agreement on how that modified structure can work, there will essentially be all of the budgetary information that will be released at the first quarter report.
We'll take our next question from the phone line.
We have Mark Smith with CTV.
Hi, we're hearing from some essential businesses, especially in the trades, that might be forced to close due to the slowdown in business that they're seeing as a result of the pandemic. Why don't they qualify for the small business emergency payments or other provincial help?
So if they are conducting as a as a business, they would qualify. And what we are doing with the investment that we have put into infrastructure is a monumental effort, essentially, to get these folks back to work and get them back to work very quickly. And you've seen some of the announcements that we've made today with respect to highways investment. You will see some additional announcements in the days ahead, understanding that construction season is upon us. But some additional announcements in the days ahead that we hope will get some of these folks, our tradespeople in community after community, back to work, as well as looking at some opportunities to enhance the opportunities for individuals to receive additional training in the days and weeks ahead. So if they are conducting themselves as an official business entity, they would qualify for the Small Business Emergency Grant. If they aren't, they should know that we are doing everything within our financial power to enhance the infrastructure investment, the public infrastructure investment in this province. Also trying to enhance the environment to encourage private infrastructure investment in this province in all of our industries so that these folks can get back to work and get back to work sooner rather than later. That's the goal.
Follow-up, Mark?
Yes, what's the process for determining which region cases are assigned to, and why was the one case reassigned from Regina to the north?
That's just the adjustment made based on the where the diagnosis was made, but where the residence and health card is registered in. Just an administrative reassignment.
We'll take our next question from the phone line, operator.
We have Chris Vandenbrekel with News Talk 650.
Hi, this question is for the Premier. Premier, in relation to the situation on Berries and Okoumesas, what is your reaction to Chief Bobby Cameron from the FSIN suggesting that police should stay off First Nations land unless they're invited?
Well, as I said in a previous question, the virus is indiscriminate in who it impacts. There are cultural and religious ceremonies and gatherings across this province and in other areas of this nation and the world, quite frankly, that have gone to great lengths to modify how they are coming together while staying physically distant. The public health orders that are in place apply to everyone. Quite frankly, because this virus applies and how it spreads also it applies to impacts and affects everyone. So the public health orders do apply across this province on all of our lands, and I would ask, and I will be talking to Bobby Cameron with respect to how we can work together, as we have with many other cultural and religious organizations and events and gatherings, on how we can do better by serving our people, but by also ensuring that they can still remain to gather, like many other gatherings have, but ensure that they are staying physically distant and keeping our communities and our citizens safe.
Follow up, Chris? Do you have a follow-up, Chris?
No, thank you.
Great. We'll take our next question from the room. Arthur?
So just today, it appears Health Canada has authorized new serological tests to detect antibodies, and I was wondering for the Premier and for Dr. Shahab if there's any plans to incorporate that into our response, particularly to know how many people might be resistant to the disease.
Yeah, I'll let Dr. Shahab speak to the bulk of this, but serological tests are most certainly, I think, very important as we look forward to the months ahead and years ahead in how we address identifying not only who has this virus, but who has had this virus. So they're a big part of understanding who exactly has had this virus, and in our approach to multiple decisions that we make in the way of preparing for healthcare outcomes, in the way of preparing for really our whole response to COVID-19. That being said, there's some time before it really becomes widespread, I believe, for public use, if you will, and I'll let Dr. Shahab maybe speak a little bit more to that in specifics.
So, and I spoke to this, I think, about 3 weeks ago as well, that we've been in constant touch with our counterparts in Health Canada. So obviously, there were many tests that are developed throughout the world of varying quality. And then the first step, of course, was to have a consensus on which tests are accurate enough to be approved for use in Canada. So that was done by Health Canada in partnership with laboratories throughout the country. And then now that tests are being approved for use, there's kind of 3 ways in how they can be used. The plan that was announced, and Saskatchewan is already a partner in that, is that to deploy that to understand how far the virus has spread as an adjunct to testing. So we already know, for example, that in Saskatchewan, less than 1% of the population actually has tested positive, and about 3% of the population has been tested. So we already know that, and once the serology test is used to measure the level of immunity in the population, there'll be one good thing to reconfirm that is our estimates of how much COVID transmission has happened. Is that confirmed by serology, or does that show that transmission is a bit higher? Because we already said that mild or asymptomatic cases may never present or be tested, but they may have a positive serology test. So that's the one thing. The second, of course, is to understand how it can be used in the clinical environment. So, of course, the serology test doesn't help you to tell you if you're infectious or not. That still has to be the PCR test that is in use in Saskatchewan and Canada, where if you test positive, you are infectious, and depending on when your symptoms started, you are infectious for up to 2 weeks. So that's how. So the PCR test will still remain an important test, but over time, the serological test may inform you were you ever infected in the past. And of course, the big answer is that how much of a protection does prior infection give you? That's a question to which a clear answer is not available. So that's another thing that the serology test will provide. But again, once it's deployed, it's used both for measuring how wide COVID-19 has spread in Canada and in Saskatchewan, but also at an individual clinical level, what does it tell you about yourself? If you were never diagnosed with COVID or did have COVID in the past, what does your serological test tell you in terms of your current immunity, and how long does that immunity last? So I think there's some really important questions that the serology test will answer, but it will take several weeks to months for those, those surveys to be done and that interpretation to be applied in terms of its clinical relevance.
Follow up, Arthur?
Are we in any talks or negotiations to acquire some of these testing machines, or are we just leaving that up to the federal government?
So the Roy Romanoff Public Health Lab, they are in contact with the National Microbiology Laboratory, so they validate the tests and will deploy them. So Saskatchewan will be one of the provinces who will be deploying that test in partnership with the National Microbiology Laboratory. But then how it's used is, again, it will be used to do a population level survey, and the University of Saskatchewan is also involved in that. But then it will also be deployed according to established criteria in terms of its clinical utility. But those guidelines still have to be developed for use in Canada.
I'll just add to that, Arthur, as the doctor said, he used these tests in a little different way than the tests that we are currently using, and it wouldn't preclude the tests that we're currently doing through the Gen Expert kits or the Roy Romanoff lab. It's really for a different reason that you would use although important and a very important tool as we look ahead into the next number of months. And this really speaks about the importance and really the water that we've navigated as provinces collectively through working together and as a nation. Of having access to the tools that we need to address this pandemic. We had many discussions about access to PPE equipment, for example, and then working with the federal government to access that PPE equipment from other areas of the world. There's been challenges sometimes with the quality of the product that's been supplied, either domestically produced or even that has been shipped in. There's been discussions around different treatments, for example, worldwide, and access to those treatments, the efficacy of those treatments, the approval, whether we can actually use those treatments or access those treatments. We've seen the Spartan test kit's been approved and then removed for various reasons, and it's really a new environment for us around not only accessing the tools that we need, but accessing the tools that will provide the quality of outcomes that we are looking for. And so there's 2 steps that really have to happen there. I think about the vaccines and how access sometimes mean that you have that product within your physical boundaries, if you will, and we're very fortunate in Canada, and I would say even more fortunate in Saskatchewan, to have the Vito Intervac lab that's operating at Saskatoon. And the work that the world-leading research that they're doing with other companies around the world on developing a vaccine or a number of different vaccines, and that's why the investment that we had joined with the federal government on in not only vaccine research but also production of those vaccines once they are approved by Health Canada, I think will prove to be a very, very important investment in our longer-term approach to addressing the COVID-19. The COVID-19 pandemic. With the testing that we're currently doing, we spoke about this a little bit with respect to Loche, but I think it's important as we really pivot across the province, and I've asked the SHA to look at, how could we expand, understanding we have the testing capacity, how could we expand our numbers, and we'll look for some direction on this in the next day or two, but how we are able to expand our testing numbers so that we can be doing some not broad-based testing, but maybe in some higher risk areas of our communities, be doing some degree of broad-based testing, using that capacity that we have so that we are able to take the very first step earlier maybe of identifying someone that is positive with COVID-19 and stepping in with our contact tracing maybe a few days earlier than we otherwise would to really have the opportunity to isolate these cases before they become a facility-wide breakout or a community-wide breakout. So there's places, for example, where that are healthcare related, where we might not have the entire staff to roll in and have that entire second shift going, and so we really want to ensure that these places are kept COVID-free, or any COVID cases are identified very, very early so that they don't become an outbreak in that facility. And one that comes to mind, from my mind, first and foremost, would be the cancer agency. We need to keep those types of places as COVID-free as possible to ensure that we don't have the challenges that an outbreak in that facility could be. And I just use that as an example. But this is where, now that we have this testing capacity, we can really look to where can we use this testing capacity to ensure that we are, keeping any outbreaks to a minimum, but two, ensuring that those outbreaks don't occur in some of our most vulnerable operations and locations in Saskatchewan. We've all seen the numbers of deaths and how those are focused with not only the elderly but in long-term care homes. The same holds true for those that are immunocompromised. And I just say that as one example, but this is what we need to turn to in the weeks and months ahead with the tools that we have. And one of those tools is we have a reasonable amount, I think would be a good word, of testing capacity that we should now be utilizing to keep Saskatchewan people safe.
We'll take our next question from the phone line.
We have Roberta Bell with Global.
Hi, my question is about the Whitebirch Remand Center. I was just wondering who determines who gets sent there, and what someone has to do to end up there. Are they people that don't have a home, people who have too many people in their home? How do you figure out if someone needs to go there, and who does that?
Marlo, would you like to clarify on that?
Yes, thank you, Premier. I can speak very broadly. It's a medical health order that sends individuals there, and it's for non-compliance. There are numerous warnings, I guess, given asking for individuals to self-isolate at a local community, whether it's a self-isolation center or trailer or RV that we've put in place. It's for those individuals that fail to comply with the local conditions and are a danger to the community. And typically, in the cases that I'm aware of, a local police service is called to limit that individual's movement, and eventually it becomes a necessity to put the individual into the Whitebirch Quarantine Center until they are no longer transmitting COVID, at which time they're released back into their community.
Follow-up, Roberta?
So can you clarify how many people with COVID are there now and how many people have been there? Is that dangerous, have that in the remand center, people who have COVID-19?
It's actually a separate location that was set up very early on the outbreak to deal with individuals that were non-compliant. So it is separate, and it has all protocols. We worked with SHA, and there are individuals in there 24/7, making sure that the person that is being held in the quarantine center has the supports they need. There's health individuals there 24/7. So it's all the protocols and safety measures are put in place by health. And at this point in time, I understand there's been a grand total of 4 that has come and gone. I believe there is 3 currently in the quarantine center.
And we'll take our last question from the room here. Steph?
Yeah, Mr. Premier, saying your government's preference to recall the legislature to present a full budget isn't the same thing as a commitment. So to be clear, do you commit to recalling the legislature to present a full budget, and if so, when?
If the House leaders are able to come to an amendable agreement on a modified schedule for a budget to not only be introduced in the House, but to be passed in the House or to go to a vote in the House, I would commit to doing that. If we're not able to come to some type of an agreement, and it won't be what it looked like before, we will. But that is our preference. Our preference is most certainly to introduce a budget in the House, have it voted on, have the legislative scrutiny that we feel this budget does deserve because of the investments that it makes. So, but it will be some type of a modified agreement, and it's my hope that the House leaders will be able to come to an agreement on what that looks like.
Follow up, Steph?
Yeah, it seems like you had a bit of a change of heart, or your answer changed on this one. Before you talked about how not many legislatures across Canada are recalling for sitting. You talked about how the spending estimates were already tabled. So, like, what changed?
I think it's always been our preference to, in some way, shape, or form, have a the budget of the province, if not released in the legislature and has that legislative scrutiny to ensure that it is being released for the purview of the people. That's why it was important for us to have the spending estimates released very early on the last day that the legislature was sitting. I think the other day I misspoke. They were not tabled in the legislature, but we did release them to the public, as well as it was important for the Minister of Finance to come out and shortly after and give her revenue estimates, of which she will do again in June, and ultimately they'll be refined as we go through the summer and what in many of us hope it will be a full reopening of our economy. There are some variations of how legislatures are sitting across this nation. I believe Manitoba might be sitting one day a week with limited services that are occurring there. A few others are looking at it. Some are coming in and out for specific bills that they might need to pass. For us, our focus would be, if we were to have some type of modified sitting of the legislature here that we can agree to with the opposition, would be to introduce and ultimately pass a budget. If we're unable to do that, we will ensure that we have that budgetary information released to the public a number of times, but most importantly at the first quarter report, where we will communicate what effectively will be all of the information that a budget would have.
And that concludes our time for today. Thanks for joining us, everyone.